Terepsi pom pe por pre mo shu sira Karenni thosho hitanama siomo pa pre lavekli he nera tananama le update lo shopya pigane si teri de kenama elu ashoke edolot para behave tamave tamanama chamai pinya pe nera veta dotama toinara tekusa sama matonara ngida chobeda kia himiti na pe totane para pingidane para shopya hengi pigane pe kia lipu Karenni pu da singidagane ki kia ngode kurikina ha nera kulula tama vehinama coronavirus ina anama torosecula ga ha etenama ringi preche kulai nara pebelo be nene tiki ga ha nama pe dutamda mai pe hinera.
And while the risk to the American public remains low, as the president said yesterday, we're ready for anything.
Ready for anything.
Anama petamada mai pen a himitina pe ready vega hanshi tilona manara dota the clonara pe below mete territory ga hamitinama coronavirus here kanama arengi prekula mina ka ha senator to inara dikanama kulunama inama pe below simply red kuimina ka dikalona ve ahine doctor da klona hinama simibi sikauba tenama atona to hemina mitinama mibi khaunama alimita tune kieda angi thar para aling rangi hene kieda roto hemina veni neda bet premethanama mibi khaun ma yakilo paneda alingi chance nama taywala papamina ka ha nara ayakilo kana ve ki etoi preloin ani kulaki kuner mangudu telalamina nera dikalo ma simply de kuga ha simply de kuga damina ku simply tatte hemina para edekina ma ode kusi para takase otege si okay klese gusi nama chak pobe mi bese be nama rengine minaga ha
a lot smaller than what the masks are going to protect against. And on top of that, if you're wearing a mask but you're not practicing any other precautions like washing your hands, you're putting yourself at risk. So again, the masks are really only for people who are already sick to prevent them from spreading the droplets. The case in California is kind of raising the right alarms. It's telling us that there's possibility for community-based transmission.
Aina seminar hidam no hand to tar friend mahina ve maybe kauna makieda au thought shoe para li ringi hening ida kia rotor minaga ha manara lo du khode ka ha mina dota sida maybe khau mitin cross ka ha na site ora ka ma re ka ka ve ha sene pe chosi sikha pe de kunni ku si pe pe maybe ne khau si posamina mitina kunema kieda angi coronavirus na mangi na mau e likely America banan o e pesingi to mina vega ha se mina kunema California na ra aupo sin lola mase luikli ha mete esi choga de photo o ve kula ke bina ve chali ne thakida to mina ni para chame o phune kieda tishu de she o hinama mana to mina ra achaphangi tek tishu batte na ra asingi to mina ka haina ra hiposana ma tishu de kana ma chatta reload pe video vana ga ha community guna.
It's not known whether patients got the virus, but officials say they didn't travel to a place with coronavirus. They didn't come into contact with any traveler or an infected person. So we're waiting as well for the CDC to confirm at least 3 presumptive positive cases. Presumptive meaning that the person's been tested by state health labs. There is a confirmation test required, however, to be done at the CDC before it's official.
Now, 2 of those cases are in Washington state. One is a woman who recently traveled to South Korea. The other is a high school student with no travel history. There's also a presumptive case in Oregon. That case is an elementary school employee whose school.
Namanda Oregon ma upapaga ha na mate Washington ra sapine na ra South Korea manada daro na ra California hina tabara da amina cho na ra achora poro ka ha ne the state nama summit halwa virus ona manada da posamine CDC Center for Disease Control nara AC belo conforme belo na ka ha belo tashi o to e besa bosa belo na khudhum angula shamina I'm him in a and then the clonoma at the return loca peto the shoot the modern the shoot kanama asemi te yoki na pa alu eng et a shop I nama ki the clonoma choche bada cloto si chobu to si hebiane ha to clora shui nama litine the cloto si nama chi o si ma bella ba ora hi nama peto the return me te ne clonara pe me yo share ka ha.
Pandemic preparedness. Here are some of the recommendations. Make sure you have enough non-perishable food on hand, things like canned foods like soups, vegetables, also grains and pasta. There's a list of things you need in your home, things that will last for at least 2 weeks. Items like this: antibacterial soap and wipes, toilet paper, tissues, and laundry and dish detergents, must-haves. Head to the pharmacy, get prescriptions filled, and buy over-the-counter pain medications and cold meds.
All those over-the-counter.
Che hidam na klonama che lo du na ka ha tomor me da si thi che da klot to na ma na pa we bya na me phil la ba ba de la ba ba ga da si hi na ma ngule sha na ma se ne se pya si discipline te khu kha da si le la tho si se ne discipline so ka ne bacteria and si virus in class ka ha para iprinika she is order apya che to si so che to si semine ngati ta si min kro ka ha to ma order she is order ne ko si ko bi pro si kro ka ha alo du kula thama pomo si jomo si da phoi phai che pasta ne kro ka ha.
Cold medicines may come in handy when people have the symptoms, because remember, most cases are going to be mild and they're going to be like the common cold.
When it comes to water, you'll need 1 gallon per person per day. You can also buy hydrating drinks like Gatorade. And you may also have to develop new routines like banking, shopping, working, and educating your children online.
There are going to be some hiccups when people have to transition to being completely online if they are quarantined. For example, they may have to telecommute to work and do teleconferences, and even schools may do instruction over online using Skype.
If you have little ones at home, make sure you stock up with baby bottles, formula, baby food, and diapers. And don't forget our 4-legged family members, buy pet food and cat litter.
Hopefully we don't get to that point where people are under forced quarantine.
Anama lo shi de krola ne do ga ha manara PS city ona ma su pinot ong la shamina she so ino para che ga ha pidona na apya pinot apya che ne ga ha manana no bar be e ve na la pidwa se mine thosi ha ki de prenoma pti cha mo ta ga la ga ha tan na na si twe ga du me ki tan na shoma she ga la me ne klo ga ha na da so na pa ma ba ka la de thama ki ba prete si myaw ne pon no ne lu mi na pa me para se ne diaper si te ku te dan si le be o to ma nge to na ma cha refill on ne da sai ku si ne me ha to ma cha phri ga te ku si te ku ne ku si pe che ngi si ne klo ga ha alo du gu lai me na ha pe me po men ngi te phra et direct cremiti na pe me me ki ha.
I could not be able to leave my house right now, and I'm good for a month. Easy.
You don't necessarily have to be like Alex Vizina, someone who has a master's degree in emergency management.
I'm at a base level of preparedness all the time.
But as COVID-19 continues to spread abroad, and more people here in Canada are self-isolating for 14 days, it may be time to ask yourself,
Do you have food? Do you have any specific medications that you need to survive? Because if you have a medical condition that requires insulin for diabetes or what have you, do you have that? Do you have an arrangement with your doctor in Canada Post or whoever to get it delivered to you?
in an effort to prevent public panic.
Anama semine hitam lebe hangole sama sari lop shabe si o ede kudeta automacheto semete ku mete suishuri mete sida rosite bega han nebe opo ma ola tu tomacheto inama kui any doctor se ga han ku si phya dwa neme na ye posi de dwa ere hi ku si himine se ga han para cha phini se so o adikana bega han nama o ne na se se ro ina mana do ga han para si ma papa mana ra pe eteri tere ni ma su pi no to si he mi ga po mo pe mi na ga han na atana ba na bega han he yo si la ba do ina ma kya de do ra comment cho bana the lot he be hu ga be bana si ga han na te bu ra ha he be na da amu yo amite ata bonne ke gu na da he be na ma ata pa be ku ne basically ha te bu ra ha bye.